Okay, it's essentially 3 minutes after the time we were supposed to start, and nobody slapped my hand yet, so I think we should begin to start. A brief introduction, as always, and then the speakers will carry off. This afternoon's session is much like the last one. We have an initial speaker and then respondents. And for those of you who are following the details, Dr. Ruth Parker will not be able to join us today, which means if anyone has an early flight, they'll probably make it, unless we ask a lot of questions this afternoon. With that, I will see if I can read again. We'll start with Dr. John Byrne, who is the Associate Chief of Staff for Education, Chief of the Clinical Informatics Section, and the Designated Learning Officer. I always just love that title. You're the one who learns. It's just phenomenally cool. At the VA Loma Linda Healthcare System. He is also an Associate Professor of Medicine at Loma Linda University School of Medicine. Dr. Byrne and his colleagues have developed and tested the After Visit Summary, a tool designed to provide patients with a summary of outpatient visits, and he recently received a grant to test providers and patients' satisfaction with the AVS. The first reaction to his presentation will come from Dr. Rachel Solitarov. I told you I was going to go a little Russian on that, so I did. Dr. Solitarov is medical director at Central City Concern, which is in Portland, correct? Oregon, yes, I could have been Portland, Maine, too. I have to be careful there. Portland, Oregon, an agency whose mission is to provide comprehensive solutions to ending homelessness and achieving self-sufficiency. Dr. Solitarov has overseen the transformation of the Old Town Clinic into a patient-centered primary care home with an emphasis on providing integrated care for individuals with complex social, medical, and behavioral health conditions, including chronic pain, addiction, trauma, and homelessness. She devotes the majority of her non-clinical time to co-creating an integrated and seamless continuum of care for vulnerable individuals at Central City Concern and within the broader Portland community. The next respondent will be Dr. Alice Horowitz, who is a research associate professor at the School of Public Health, University of Maryland. She made it here today. So pats on the back for all of you who did that locally. She has initiated statewide research on what the public knows and does about preventing dental caries and their perceptions of communication skills of dental providers, and on healthcare provider reported use of recommended communication practices, and that includes physicians, nurse practitioners, dentists, and dental hygienists as well. Formerly, Dr. Horowitz was a senior scientist in the Division of Population and Health Promotion Sciences at the National Institute of Dental and Craniofacial Research. And with that, Dr. Byrne, the show is yours.